You don't want to think about that three-letter word right now, but the flu has a way of catching up to you if you're not prepared.
13 News Now reporter Allie Weatherton talking to an expert tonight to find out why you need to get the vaccine now.
It's just a small pinch that can make a big difference. Doctors say you shouldn't wait to get the influenza vaccine.
There's no downside to getting it early, and with regards to worrying about if it's going to last the entire flu season, it will.
The Center for Disease Control is also urging anyone 6 months or older to get the vaccine earlier than normal, although officials say this year's flu season is still unpredictable.
For example, last year was considered a relatively mild season, but what strains are out there kind of change year to year, so it's kind of early to tell what kind of season we're going to have.
Flu season typically starts between October and November and peaks around February, and it can last until May, like it did last year. EVMS Ghent family medicine physician John Snelling says the office he works in started offering the flu vaccine about 2 weeks ago.
When patients come to our practice, they are proactively asked if they'd like the flu shot today, and most patients do accept it.
And if you're not a patient, there are plenty of other places also offer the shot or nasal spray, which Dr. Snelling says works just as well. Most are walk-in clinics at local pharmacies, and it doesn't matter where you get the vaccine. Dr. Snelling says just make sure you get it.
It takes a few weeks to kick in fully to provide you immunity, so it can't hurt to get it now and really allow it to get into your system and provide you that full immunity.
Allie Weatherton, 13 News Now.
Some people may not be able to get a flu shot, so check with your doctor before you get one. How do you know if you have the flu or a cold? Let's run down the symptoms. Doctors say the flu comes on quickly. More than likely, you'll get a high fever, aches, pains, chills, and more. With a cold, you'll get sick over time. The symptoms are a little different. You're less likely to have a fever with a cold, but more likely to have a stuffy nose and sore throat.